Welcome to ENT Simplified. This is an educational channel for ENT and head and neck surgery. I am Dr. Gaurav Datta, consultant ENT and head and neck surgeon. Today we'll talk about epistaxis, its cause and its first aid and prevention. Epistaxis simply means bleeding from the nose. It seems to be frightening at the first sight, but in most of the cases it's not so much serious if it is managed effectively and urgently. Epistaxis mainly occurs due to the disruption of the tiny blood vessels, most commonly at the anterior side of the nasal septum, which is called as Kisselbeck's plexus or the Little's area. Epistaxis are mainly of two types. It can be anterior epistaxis, where the blood trickles anteriorly, or the posterior epistaxis. The most common predisposing factors are dry air, allergies, recreational drugs, blood thinning medications, high altitude, or DNS. The most common causes are the local causes due to local trauma, anatomic irregularities, inflammation, facial trauma, topical nasal sprays, or any tumors which are present in the nose and paranasal sinus, or the systemic causes like high blood pressure, vascular malformation, severe disease, or bleeding disorders. Now let's look at some quick tips to stop a nasal bleed fast and urgently. As soon as the nasal bleed starts, you have to start with the Trotter's method. In this method, the patient has to sit upright and lean the head little bit forward, pinch the nose tightly for at least 10 minutes, and avoid laying down so that the blood could not trickle in your airway, and it may lead to aspirational pneumonia if the blood trickles down to your airway. You have to perform this method for at least 10 to 20 minutes, but if the bleeding does not stop, even after a properly done Trotter's method for 20 or more minutes, or if the amount of the bleed increases, then it's the time that you have to consult an ENT surgeon for the further management of your epistaxis. ENT surgeon most commonly uses nasal packs, electrocautery, or sometimes in severe cases of epistaxis have to go for neck exploration in order to ligate the great vessels in the neck. For all other further managements which are done by an ENT surgeon, I would like you to look at my next video, which is the how to approach epistaxis for the ENT surgeons, in which there is a detailed approach of how to go forward with a patient of epistaxis, starting from the diagnosis, management, and proper follow-up. For any ENT related queries, you can contact me on the given details. Please like, share, and subscribe. Thank you.